In a widely shared social media post dated 10th August 2025, Shaira Bugarin recounted a deeply troubling incident involving the death of a patient, allegedly due to delays in medical attention, poor coordination, and lapses in communication and care at the East Avenue Medical Center. The post, along with additional comments, highlights disturbing experiences that appear to reflect broader systemic issues within our public healthcare system. While these remain allegations, I filed Senate Resolution number 66 out of concern to initiate an inquiry that emphasizes the importance of ensuring compassionate, timely, and well-coordinated care in our hospitals. This resolution also seeks to strengthen oversight, accountability, and patient engagement, which are essential in maintaining public trust and upholding the integrity of our healthcare institutions. For the record, EAMC has released an official statement affirming that the health and well-being of its patients remains its top priority. The institution asserted that its frontline healthcare providers acted with professionalism and compassion and maintained that the standard of care appropriate for a patient in an advanced stage of illness was rendered. Furthermore, EAMC stated that an administrative investigation into the matter is already underway. So, for starters, may we request a representative, no less than the hospital director from EAMC, to provide an update on the findings or results of the ongoing investigation at paki-inform po ang komite sa mga aksyon na sinagawa na po para tugunan yung mga concerns na ni-raise. Dr. Nunez.
Good morning, Madam Chair, and may I be allowed to read our position paper regarding this matter, Madam Chair? And
how long is the position paper,
this
Doctor?
is 3 pages, Madam Chair, and this is the summary of what we have done.
Please
and
proceed, sir.
If you have any questions, Madam Chair, I'm glad to answer them. This is the response to the viral post, the late patient Bernardo Bugarin, and the Senate Resolution number 66 about the East Avenue Medical Center. This position paper is respectfully submitted in relation to Senate Resolution number 66, introduced by Senator Risa Hontiveros, which calls for an inquiry into alleged negligence and issues at East Avenue Medical Center, or the EAMC. Following a viral Facebook post on the care of the late Mr. Bernardo Bugarin, who is diagnosed as a case of late-stage glioblastoma, described as left parietal lobe mass extending to the splenium of both corpus callosum, with intralesional hemorrhage with mass effect subsequently. Acute respiratory failure type 1 was developed on the patient due to severe pneumonia. Upper gastrointestinal bleeding secondary to bleeding peptic ulcer disease with diabetes mellitus 2 and insulin requiring controlled and sepsis. The AMC fully recognizes and respects the Senate's vital oversight role in ensuring accountability and the protection of the people's right to health. In this light, we wish to clarify that the viral post does not fully reflect the actual medical management provided, nor does it capture the true character of East Avenue Medical Center as an institution. The official medical records and investigations show that comprehensive and appropriate care was rendered, which stands in contrast to the impression conveyed in the viral post. EAMC is a DOH-retained tertiary hospital that provides healthcare to thousands of Filipinos daily, many of whom belong to marginalized and vulnerable sectors. Despite resources limitations, the hospital has consistently endeavored to deliver quality, compassionate, and professional care to every patient. The viral post, while expressing grief and frustration, has created a negative image that is not representative of the institution or its healthcare workers. AMC remains committed to demonstrating through both action and transparency that its mission is anchored on patient-centered care and public service. Based on medical records and the investigation report, number 1, there was prompt emergency response on both admissions on the patient. The patient was promptly attended to and provided with stabilization and immediate intervention. EAMC also provided specialist management born out of the patient's condition by providing multiple services, including neurology, neurosurgery, internal medicine, pulmonology, endocrinology, gastroenterology, and infectious disease specialists were involved to ensure comprehensive care. Critical interventions were also given to the patient. The patient received advanced management, including intubation, oxygen, and ventilatory support, antimicrobial and antifungal therapy, blood transfusion, and continuous monitoring. The patient also was given end-of-life care. The healthcare team exhausted all resuscitative efforts until the patient was formally declared deceased on July 25, 2025. These facts highlight that diligent and appropriate care was consistently provided, which differs from the perception created by the viral post. The following are the general lessons learned and the actions taken. East Avenue Medical Center, a key public tertiary hospital under the Department of Health, currently operates under a no-refusal policy for emergency admissions. While this policy upholds the ethical imperative of universal access to care, it has led to severe overcrowding and operational strain, particularly in the emergency room. EAMC is currently operating a 1,000-bed capacity supported by an authorized staffing complement of 2,499 personnel. However, this falls significantly short of the ideal staffing of the 2,859, resulting in a manpower deficit of 911. This shortfall has led to the following. Number one, non-congruent patient-doctor ratios, particularly in high acuity areas. Second, compromised care delivery with frontline teams stretched beyond optimal capacity. And second, there are some delays in service turnaround time, especially in diagnostics, referrals, and bedside intervention. Our ongoing corrective actions and quality enhancement are the following. To further strengthen patient care services and institutional responsiveness, EAMC is implementing the following corrective measures. Number one, streamlining diagnostics and referral. Coordination with partner hospitals to reduce turnaround time and ensure continuity of care, especially for the magnetic resonance spectroscopy, which was not available or is not available in East Avenue Medical Center. Second, institutionalizing family conferences for critically ill patients. Mandatory family conferences facilitated by the consultant directly in charge have been adopted with standardized documentation to ensure transparency and accountability. To ensure clearer communication with families regarding the patient management, we have issued a Hospital Order 26/2025 to this effect. For subspecialty referral protocols, implementation of a standardized referral framework to improve coordination and access to subspecialty services. And to this, we have issued a Hospital Order number 22, Series 2025, to help all of our healthcare workers. There is continuous staff development and communication. And for this case, we will have to reorient our staff on professionalism, patient rights, and effective communication with families. Referral system for difficult bug extraction was also noted in the blog, and there is an established streamlined channel to facilitate timely and appropriate referrals for challenging phlebotomy cases. In conclusion, EAMC extends its deepest sympathies to the family of Mr. Bugarin. We understand their pain and grief, and we respect their right to raise concerns. At the same time, it is important to present the facts. The vital post does not represent the full truth of the care provided, nor the real image of East Avenue Medical Center. The hospital and its staff acted with professionalism, compassion, and diligence, as supported by documented medical records. Moving forward, East Avenue Medical Center remains committed to continuous improvement, transparency, and its constitutional mandate to deliver fast, efficient, convenient, and reliable healthcare services for all, aligned with the strategies of the Department of Health of accessible health services, financial risk protection, and better health outcome. With this, we thank you, Madam Chair, for listening to our position paper.
Salamat, Dr. Nunez. Have you provided a copy of that position paper to the committee?
Yes, ma'am. We have sent this yesterday afternoon.
Thank you.
Yeah.
And have you communicated, if not the position paper, but the substantive contents, na communicate nyo rin po ba sa pamilyang Bugarin?
Madam Chair, we were from the very start when the post was issued, we were trying to reach out to the daughter, Ms. Bugarin. She only, based on our records, she only recognized our communication to her, but never responded back. Moving forward, we have invited her to our hospital, or we even offered to go to her for some talks and discussions for the specifics of sa kanyang experience. But until now, wala pa hong response sa kanya. We also insinuated that she can go to DOH or other institutions she is more comfortable to relate, but wala po kaming word galing sa kanya po.
Salamat, Doctor. Well, the committee also expresses its deepest condolences to the Bugarin family.
Kung maaalala niyo po, yung nabanggit ni Dr. Cito Nunez, babalikan ko yung East Avenue, yung kaso po ng ating pasyente. Kung di ako nagkakamali, meron siyang brain parang lesion na sinasabi. Maaaring cancer siya, isa pa yung sitwasyon po. Sa cancer naman, may mga pagkain, may mga exposures, may mga risk factors sa ating kapaligiran na maaari sana maiwasan through health promotion para hindi na mapunta sa ospital, hindi na dadagdag sa pila, hindi na kailangan dumaan sa ganyan. And very, very final point na lang po. Sa medical school, tinuturo po nila na napaka-importante ng interpersonal communication. Yung sinasabing bedside manner. Kaya nga po sabi nila, medicine is both an art and a science. Baka po, tama po yung sinabi ng ating Philippine Alliance of Patient Organizations na kailangan yung pakikitungo dun sa pamilya. Dahil marami pong naaayos na or na-manage na expectations kapag ang doktor, and not only the doctor but the care team, pati yung buong team po, no, yung ating mga nurse ay nagkakaroon ng regular interpersonal communication, not on social media, not to chase clout, not in public, etc., but at the bedside sa ating ospital, kung saan nandun po yung honest to goodness na ito ang sitwasyon ng ating pasyente, ito ang ating pwedeng gawin, ito ang pwedeng mangyari. Salamat po, Madam Chair.
So, just to conclude this part of our hearing, bago tayo dumako sa iba pang agenda, in the exercise of its oversight powers, the committee calls on the East Avenue Medical Center to submit the full investigative report along with a clear and actionable plan na meron na rin pong timetable, Director Dr. Nunez, clear and actionable plan to address the serious issues raised in the recent viral social media post. It is our solemn duty to ensure that patients are protected from unethical, negligent, or abusive practices in all healthcare facilities. To this end, we also urge the Department of Health to establish and strengthen accessible grievance mechanisms such as, gaya ng nabanggit ko po, expanded sumbungan boards that will allow the public to report hospital-related concerns directly and effectively. At isama na po natin yung panukala ng PAPO na grievance and redress na platform o app. No? Patients should not be forced to turn to social media or appeal to senators just to be heard. Complaints about overbilling, unauthorized charges, denial or delay of care, even when not related to deposit issues, medical malpractice, violations of informed consent and patient confidentiality, abuse by healthcare workers, discrimination, and other abuses or breaches of health and patient protection laws must be addressed promptly and seriously by the proper channels. The system must work for the people. Their voices, ang pamilyang Bugarin, lahat ng pamilya, their voices deserve to be heard and more importantly, acted upon.